Today, we're talking about Clocortolone Pivalate Cream. This medication is used to treat a variety of skin conditions like eczema, dermatitis, allergies, and rash. It works by reducing the swelling, itching, and redness that can occur in these types of conditions. Clocortolone Pivalate Cream is a medium-strength corticosteroid. It's important to use this medication as directed by your healthcare provider. Typically, you'll apply a thin layer to the affected area once or twice a day. It's best to use it at the same time each day to help you remember. If you have any questions or concerns about using this medication, be sure to talk to your doctor. When using Clocortolone Pivalate Cream, make sure to only apply it to the affected skin and avoid using it on the face, groin, or underarms unless your doctor tells you to do so. Before applying the cream, wash and dry your hands and clean the affected area. Then, apply a thin layer of the cream and gently rub it in as directed by your doctor, usually 3 times a day. Avoid bandaging or covering the area unless your doctor instructs you to do so. After applying the cream, remember to wash your hands unless you are using the medication to treat your hands. Be careful to avoid getting the cream in your eyes, nose, or mouth, and if it does accidentally get in these areas, rinse with plenty of water. Only use this medication for the condition it was prescribed for and not for longer than directed. If your condition does not improve or worsens after 2 weeks, be sure to inform your doctor. When using Clocortolone Pivalate Cream, you may experience stinging, burning, itching, irritation, dryness, or redness at the application site. These effects should go away after a few days, but if they persist or worsen, let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, if you experience serious side effects such as stretch marks, skin thinning or discoloration, acne, unwanted hair growth, or small red bumps on the skin, contact your doctor immediately. Using this medication can worsen skin infections, so if you notice that redness, swelling, or irritation are not improving, notify your doctor promptly. In rare cases, this medication can be absorbed into the bloodstream, leading to side effects of too much corticosteroid. If you experience unusual tiredness, weight loss, headache, swelling of the ankles or feet, increased thirst or urination, or vision problems, contact your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Before using clocortolone, make sure to inform your doctor or pharmacist if you are allergic to it or other corticosteroids. This cream may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Before using this medication, let your doctor or pharmacist know about your medical history, especially if you have poor blood circulation or immune system problems. Do not use this cream if there is an infection or sore in the area to be treated. Using corticosteroid medications for a long time or over large areas of skin can make it more difficult for your body to respond to physical stress. Before having surgery or emergency treatment, or if you get a serious illness or injury, make sure to inform your doctor or dentist that you are using or have used this medication within the past few months. This medication may temporarily slow down a child's growth if used for a long time, so it's important to see the doctor regularly for height checks. During pregnancy, this medication should only be used when clearly needed. It is also unknown if this drug passes into breast milk when applied to the skin, so it's important to consult your doctor before breastfeeding. When using Clocortolone Pivalate Cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Clocortolone Pivalate Cream. If this medication is accidentally ingested, it can be harmful. If an overdose occurs and serious symptoms such as passing out or difficulty breathing are present, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222. In Canada, residents can reach out to a provincial poison control center. Clocortolone Pivalate Cream is used to treat a variety of skin conditions such as eczema, dermatitis, and psoriasis. It works by reducing swelling, itching, and redness. Apply a thin layer of the cream to the affected area as directed by your doctor, usually 2 to 3 times a day. It is best to use this medication at evenly spaced intervals throughout the day to maintain a consistent level of the drug in your body. Be sure to wash your hands before and after applying the cream, and avoid getting it in your eyes, nose, or mouth. Remember, this medication is prescribed specifically for your current skin condition. Don't use it for other skin problems unless your doctor tells you to. Your doctor may need to do some tests while you are using this medication, especially if you use it for a long time or over large areas of your body. Make sure to keep all your medical appointments and consult your doctor for more information. If you forget to use a dose of Clocortolone Pivalate Cream, apply it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and continue with your regular schedule. Do not use a double dose to make up for the missed one. Make sure to store Clocortolone Pivalate Cream at room temperature and avoid freezing it. Keep it away from children and pets. When it is expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.